One of the reasons that we vaccinate infants is because we want to prevent chronic infection. When newborns get hepatitis B infection, they have a 90% chance of this going on to cause chronic infection. And that means that a quarter of them will end up dying from hepatitis B related diseases such as cirrhosis or liver cancer. So the recommendation since 1991 has been to give universally, to give every newborn, every healthy newborn infant, hepatitis B vaccine starting at birth, and that's the first dose of a 3 or 4 dose series. This recommendation turned out to be a tremendous success, decreasing infant infection by over 99%. So the new CDC recommendations are to delay that birth dose to 2 months of age, and also they're recommending for parents to consult with doctors to do blood tests after every dose to see if children have formed immunity. There's no evidence behind these recommendations, and mainstream medical organizations, all of them are rejecting these recommendations from the CDC. So some of the kids are going to fall through the cracks. We're not going to get them immunized. We're not going to prevent infection. And that's going to result in about an additional 1,400 children getting infected every year in the US. About 480 of them will end up dying from hepatitis B consequences. What changed was that the makeup of the Advisory Committee on Immunization Practices to the Centers of Disease Control was changed. Before, it was unbiased scientists who were well qualified to make these decisions, and it was evidence-based. They're not looking at data, they're cherry-picking studies, the decision-making is not transparent, and they're not sharing data with the public. So it's really an unqualified committee. It's disappointing because what this results in is a lot of confusion to parents because we've got these conflicting recommendations, and really for so many years the CDC has been a reliable, apolitical organization. But unfortunately that's changed this year. I would really recommend for parents to discuss this with their healthcare provider, with their pediatrician, with their family practitioner. They're the ones who are going to know best for their patients, for your child.